How to look up physician fees. We are talking about the basics, which is to look up the Medicare fee schedules to medical doctors and providers. So you must go to this website here, cms.gov, Medicare/physician fee schedule/search/license. And when you search for this, you'll be able to find it. You can read all this information, and it's important to read, but the bottom line is you must accept the terms. And once you accept, it goes to the actual search page. So the search page can be a little bit confusing, but you must put in the year where you want to search the fees. You can put in other years if you want. And you need to know the type of information. For our purposes, just select all. You can go back and see if there's anything else you want to look at. And then for the purposes of searching, you must identify what's called the Healthcare Common Procedural Code System criteria. And it gives you options of looking at a single code or a list of codes. And later on, we'll use the list of codes. Again, for our purposes, choose all modifiers. And you need to understand this thing, the Medicare Administrative Contractor option. In other words, in which location are you searching these fees? We are in Florida, so we would like to look at the specific locality. And in this specific locality, you can just put in your state. Sometimes certain states have different areas. Like for Florida, Miami has a higher rate than the rest of Florida, but I'm in the rest of Florida criteria. So this is the information you'd look for. The next step, of course, is trying to understand how to look up these HCPSC structured fees. So you can look up the HCPCS. In this example, I did use Google, and then I did put in the HCPSC code for a new patient office visit. And so it did come out with some information. 99202 is an office visit. That's used more by the primary care physicians and physician extenders. I typically, as a specialist, would use 99203 or 99204, but now you have an idea of how to look up these codes. Common medical procedures include 99203, new patient visit, 99213, follow-up medical visit, 97110, therapeutic exercises, 98941, chiropractic manipulations, and 20610, injection into a major joint. I have gone ahead and put the individual HCPCS codes in on a list of codes over here. And then if you hit the search fees button down here, it will list these codes in this manner. So it goes in numerical order. The first one is 20610, which is the injection of a major joint. And the fee for that maximum is going to be $71.19. The therapeutic exercises, as we see here, maximum is $31.81. And again, there's the chiropractic manipulations, maximum being $42.83. The office visit for a new patient would be $122.66, and the office follow-up would be at maximum $98.05, depending on your locality. Common surgical procedures include 44950 for removal of appendix, 29881 for knee arthroscopy with partial meniscectomy, 64479 lower back steroid injection, 63030 lower back disc removal, 22551 neck disc removal and fusion from the front. I now listed the codes for surgical procedures, as you can see right here. And if I search for these fees, it will then identify the fees paid by Medicare in the rest of the locality, Florida, and for this year of 2023. This code 22551 is for neck discectomy and fusion surgery, and the fee maximum is $1,988.69. Code 29881 is knee arthroscopy and meniscal partial resection. The maximum fee is $609.64. 44950 is the appendectomy code, and the maximum reimbursement to the surgeon is $740.30. Code 63030 is lower back disc surgery, and the maximum reimbursement will be $1,056.22 to the spinal surgeon. And then the code 64479 is the code for injection of epidural steroids into the cervical or upper back, and that maximum fee would be $285.22. This code and this fee is when this is performed at a doctor's office. I know this process of looking up physician fees is not easy. Please take your time to find the right ACPCS codes or CPT codes. Make sure you put those codes in for your year in geography on the Medicare fee lookup schedule. And understand these are the fees that your medical provider, your doctor, your surgeon, your physician extenders, your therapist will receive for Medicare for those codes. Understand that when you get a medical bill from your doctor's office or the hospital, typically you'll have a pretty large price, a list price. But that list price is not what's actually paid to your provider. The contracted fees are often based on a percentage or a multiple of these Medicare fee schedules, and most doctors or medical facilities will negotiate for these fees. We're in Florida. In Florida, more than 90% of the doctors have agreed to accept these fees as payment to provide service for Medicare recipients. So you have an understanding of what the doctors are accepting in your locality by looking up these fees. I hope this information was useful to you. Please continue to search and take your time, and I do think you'll find the information you need. Thanks for watching.